First of all, we are checking our instruments for safe introduction, which is the varus needle and spinal needle 23 gauge and 2 syringes, 1 syringe with saline filled halfly to give chance for bubbling, and another syringe 20 cc, 10 cc of xylocaine and 10 cc of marcaine. Very effective to avoid pain for the trocar sites. And sometimes we use in a major cases, the rest of this for blocking the pain post-operative for tap blocking. During introduction, first we introduce the varus needle central in the umbilicus. This is the thinnest point, and we notice the double click sign. Of course, we test the needle before to check the spring will work efficiently and that it's not obstructed by anything. Then we do the first test, that we do infusion of saline and withdraw it to see the bubbling. After this, we put the gas and we listen to the whistle for negative pressure, or if the other insufflator, we just look for the negative pressure or pressure below the 8 mmHg, and we start the insufflation. After half liter of gas, we start to do percussion at the subhepatic region to ensure that it is resonant, and we notice that the insufflation is homogeneously distributed, not confined to a specific area. At pressure between 12 and 15 mm, and it's different in the volume, we start to do the test by the spinal needle. We introduce it perpendicular to the abdomen in 4 points at 12, 3, 6 and 9 o'clock, and during introduction we withdraw to know 2 important things. Number 1, the thickness of the layers below us, and number 2, if there is something obstructing our introduction. Then we take the primary trocar. Mostly we use the sharp one or the safe one. I hold it by my hand and the index finger just 1 to 2 centimeters from the tip to avoid sudden blowing or excessive pushing of the trocar inside the abdomen. We do the incision wide enough to avoid resistance, and we started to put it and to move rotational movement to just penetrate the peritoneum or the layers, and then just we will listen to the sound of the air coming out. This is the sign that we go inside safely without hitting anything. Counter resistance increase the incidence of forceful movement that may lead to blowing force that lead to injury. And then we go immediately with the lens and camera to check. Thank you.